Hello everyone, this is Stacy Scroggins, and this week I am reviewing an article entitled A Contemporary Approach to Validity Arguments, a Practical Guide to Kane's Framework. This article was published in the journal Medical Education in 2015. So before we go into Kane's framework, I would like to first define and discuss the terms validity and validation. These are easily confused, and so I just wanted to make sure that we're all on the same page before we jump into this article. Validity is a conceptual framework for interpreting evidence, and it refers to the use of a test for a particular purpose. Validity also references something that is considered to be genuine or true. Validation, on the other hand, is a process of collecting and interpreting evidence to support a decision, and the purpose of validation is to collect evidence that evaluates whether or not a decision and its consequences are useful. So how does validity and validation relate to medical education? Well, as I'm sure we're all aware, medical education is moving more and more into competency-based programs, and it's very important that we have the tools in order to assess different strengths and weaknesses of the learners and determine their mastery of certain skills and clinical judgments. It's also important that medical educators fully understand the strengths and weaknesses of the assessment tools that are being used to determine learner competency. So what exactly is Kane's framework? Kane is a researcher who developed the most recent validation theory, and Kane's framework applies equally to individual quantitative, qualitative, and programs of assessment. And this is important because Kane's framework is different than previous validation theories that did not create a valid reference standard when intangible attributes existed, such as when we're looking to evaluate professionalism. Kane addressed the issue of prioritization by highlighting key phrases and planning and evaluating the validity argument. So what exactly is the validity argument? And basically, this guides the collection and argument of validity evidence. So the article first used an example of a courtroom and a judge that is hearing evidence presented from two sides. And the judge is hearing the evidence and will eventually make a decision based on the evidence found. So like the judge or similar situation, an educator can collect empiric evidence from multiple sources and organize the evidence into a validity argument. And it's important to focus on the weakest links or the ones that are most questionable in the assumption. And Kane's framework uses multiple individual assessments to make judgments. This slide is actually Kane's framework and some of the key elements in the validity argument. And you can see here where the arrows are located, there's 4 different areas, and that's scoring, generalization, extrapolation, and implication. And scoring is translating an observation into one or more scores as a reflection. Generalization would be like having test scores that could reflect on the amount of learning or competency that a student has. Extrapolation is using the score as a reflection of real-world performance, such as a simulation. And implications is applying the score to inform a decision or an action. So it's also important to note that tests with a pass-fail decision may require different priorities in this validity evidence than the raw data scores. So the conclusion of the article wants to emphasize 4 main points. 1, validation is not an endpoint, but it's a process. And just because something says that it has been validated, it just means that there's been a process applied to the problem, and it does not indicate how something should be interpreted. 2, validation ideally begins with a clear statement of what we're trying to interpret and how we're going to use that and apply that. It continues with carefully planned validity argument. And we also want to define the key claims and assumptions when we are performing that validity argument. Number 3, educators should focus on the weakest links in the chain of inference. The weakest links are possibly or are the most questionable assumptions. 4, implications and association decisions are the most important in the validity argument. So the evidence that supports Scoring, generalization, and extrapolation is fairly strong, but the implication and association decisions, that is the strongest evidence that supports the decision. This is the annotated bibliography reference, and I thank you all for listening.